Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology Pharmacy Institute. Today I am here to give a lecture on subject Pharmacology-I with the subject code BP404, especially 4th unit. In the previous session we had studied about the neurotransmitters, some important neurotransmitters like inhibitory neurotransmitter and excitatory neurotransmitter. In this session we are going to learn about the general anesthetic drugs. So, without any further delay we will dive into the session. So, what are the general anesthetics? General anesthetics, before going to the general anesthetic, let us see the definition of anesthetics. So, what are an anesthetic drugs? The anesthetics are the drugs which will produces the reversible loss of sensation. Okay? So, it will relieve the pain when you are administered to the body, when you are administered by either whatever it route may be. Now, these anesthetic drugs will reduces the pain, it will produces the reversible loss of sensation, and these anesthetic drugs are of two types. One are the general anesthetic drugs and the local anesthetic drugs. If you are applying the anesthesia on the local area on a particular part of your body, then you can call it as a local anesthetic. So, it will shows its action on a particular area. So, what about in a general anesthetic? General anesthetic is a drugs, it will shows its action in a wide range in your body. So, once you had administered the general anesthetic drugs, it will causes the loss of sensation. What is the loss of sensation here? Reversible loss of sensation, irreversible, no, it is not an irreversible. Once you had administered the general anesthetic drug, it will causes the reversible loss of sensation. And once the anesthesia has been eliminated from the body, your consciousness will be get back, right. So, what are the major features of these general anesthetic drugs? So, we having the major features like it will relieve the pain. So, what is the major feature? First one, it have to relieve the pain, right. So, what is the purpose you are going what is the purpose you are going to administer anesthesia? So, to administer anesthesia to reduce the pain, to relieve the pain. So, it will relieve the pain, and second it have to relax the muscle. So, it have to relax the skeletal muscle. Once you had administered the general anesthetic drug, after relieving the pain, it will relax the muscle also. It will produces the analgesic action. It will abolish the some reflexes like somatic reflex and autonomic reflexes. So, all the reflexes will be get abolished with the general anesthetic drugs. These are the features of a general anesthesia. First, it will reduce the pain, it will relieve the pain, and it will produces the analgesic action, it will relax the muscle, it will induce the sleep, and it will abolish the reflexes like somatic reflex and autonomic reflex, right. So, now we will move to the stages of general anesthetics. So, if I am talking about these stages, the general anesthetics has been classified into 4 stages, which you are called as stage 1, stage 2, stage 3 and stage 4. So, each stage having the different name here. So, if I am talking about the stage 1 is also called as an analgesia stage. Stage 2 is also called as a delirium stage, or you can call it as an excitement stage. So, you can call it the stage 2 is also an excitement stage, excitement or delirium, and stage 3 you can call as a surgical anesthesia. Okay. And 4th stage you can call as any respiratory depression or medullary paralysis. So, we having mainly 4 stages for the general anesthetics. Once you had given the drug will enter into the 4 stages. What are the 4 stages here? Stage 1, stage 2, stage 3 and finally stage 4. Stage 1 you can call as a stage of analgesia. Okay. Stage 1 is called as a stage of analgesia. What about stage 2? Stage 2 is called as a stage of delirium or stage of excitation. And what about the stage 3? Stage 3 is called as a surgical anesthesia or stage of surgical anesthesia. And what about the stage 4? Stage 4 is called as a respiratory depression stage, a medullary paralysis stage. So, we will discuss one by one stage here. So, first we will move to the stage 1. The stage 1 will be seen from the administration of an anesthetic drug, and it will last up to the loss of consciousness. So, how long time the stage 1 will be seen here? Administration of an anesthetic drug, and you can see the loss of consciousness up to the loss of consciousness. and in this stage the person can relieve the pain will be get abolished, but the person will be in a conscious, he can able to see, he can able to hear, he can able to dream. So, what the patient can understand what is going to happen around him or her, right. And in this stage, especially in the first stage, the minor operations can be carried out like dental operations. So, dental operations you can choose in the stage 1 stage, okay. And in this stage 1 you can see the respiration will be the very normal, there will be no fluctuation of an respiration, the respiration will be remains normal, and the person will be rapidly passes into the stage 2, okay. So, this is about the stage 1. The stage 1 will be starts from the administration of an anesthetic drug and it will last up to the loss of consciousness. Here the person can able to see, here the person can able to hear and he can dream, the respiration will be normal, the blood pressure will be normal, but the only thing happens here, the person will be rapidly enter into the stage 2. The minor operations like dental operations you can carry it in the stage 1, okay. Stage 1 is called as this is the reason why you call it as an analgesia stage. And second one is the delirium stage, or you can call it as an excitement stage. Why it is called as a stage of excitement? Because when the person entered into the stage 2, after completion of stage 1, the person will be rapidly enters into the stage 2. When the person entered into the stage 2, why this stage is called as a stage of excitement? Because here the person will get excited, the person will shout, the person will can shout, the person will can excite here, and the person can induce the vomiting, and here the blood pressure will be get increased, hyperventilation is been seen, muscle movement will be get fluctuated. So, increase in muscular activity, all this will be seen in the second stage, but all these things we can be minimized or abolished by giving the pre-anesthetic drugs, okay. So, the stage 2 is also called as a stage of delirium or stage of excitation. Why you can call it is a stage of excitation? Because once the person enter into the stage 2, here the person can feel excitement, here the person can induce the vomiting, here the person can shout, here the person cannot cooperate with us. So, here you can see the increase in muscular activity, increase in the blood pressure, hyperventilation, all these things will be seen in the especially in the stage 2. All these things can be abolished by giving the pre-anesthetic drug. So, what are the pre-anesthetic drugs? I will explain in the next lecture. Okay. So, next one, stage 3. So, here if so here the nausea and vomiting you can observe in the stage 2, hyperactivity, irregular respiration, irregular hyperventilation you can see here, right. So, this is the thing you can observe in the stage 2. And what is a stage 3? Stage 3 is also called as a surgical anesthesia. Why it is called as a surgical anesthesia or stage of surgical anesthesia? Because the major operations like surgical operations you can perform at the stage 3. Okay. And here the respiration you can see the regular respiration to the somewhat fluctuations in the respiration. And if I am talking about this stage 3 anesthesia, it has been further classified into 4 planes, plane 1, plane 2, plane 3 and plane 4. Okay. Now, this surgical anesthesia has been classified into 4 planes. Okay. Plane 1, plane 2, plane 3 and finally plane 4. Okay. This is the 4. Okay. So, we having the in surgical anesthesia the stage has been further divided into 4 planes, plane 1, plane 2, plane 3 and plane 4. If I am talking about the plane 1, in plane 1 and plane 2, in both planes the blood pressure will be the normal. So, you had said you in the stage 2 the person can excite, the person can shout, the person can produce the vomiting, hyperventilation, increase in the blood pressure, increase in the muscular activity, all these things will be abolished in the plane 1. Okay. All these things will be abolished in the plane 1. If I am talking about plane 2, in plane 2 here the increase in decrease in blood pressure will be seen. So, whatever the things you had seen in the stage 2 analgesia, everything will be abolished in the plane 1, especially in the plane 1. So, there will be no excitement of any patient, there will be no increase in blood pressure, there will be no shouting of any particular patient, there will be no increase in muscular activity. Okay. When the person enter into the plane 1, here the person can cooperate to the surgery. Okay. In this plane 1, here we can see the decrease in the blood pressure, right. And in even plane 2 also you can see the decrease in blood pressure. The decrease in blood pressure you can see in both plane 1 and plane, even not exactly decrease in blood pressure, the respirational blood pressure is somewhat normal in the plane 1 and plane 2 compared to that of 3 and 4, right. If I am talking about these plane 3 and plane 4, here the blood pressure and respiratory stimulation will be get decreased, okay. And if I am talking about the plane 2, here the corneal reflex will be present, but when the person enter into the plane 3, the corneal reflex also will get abolished. Okay, the corneal reflex also will get abolished. And what about the plane 4? When the person enter, when the anesthesia enter into deep, now the person will go into the plane 4. In plane 4, what you can see here? Here the blood pressure will be get down, it will fall more and more, and here the pupil also will get dilated. Okay, these are the 4 planes. So what are the 4 planes of the surgical anesthesia? Plane 1, plane 2, plane 3, plane 4. In the first 2 planes, you can see the normal blood pressure and normal respiration rate, and when the person enter into the plane 3, you can see the decrease in blood pressure, decrease in blood pressure or decrease in the heart rate, right. And in the plane 3, you can see the corneal reflex also has been lost. In plane 2, up to the plane 2, the corneal reflex will be present, right. And what about this one, stage 4? What about this stage 4? Stage 4 is also called as any medullary paralysis. Why it is called medullary paralysis? Once the drug has been entered into deep and deep, here the person will enter into the stage 4. Here the person can causes the respiratory depression, and this respiratory depression will be differ from the anesthetic to anesthetic drug. For example, if I am taking the halothane drug, okay, halothane, ether, both are the anesthetic drug. If I am taking the halothane can induce the hypotension much more than ether. And if I am talking about either having capability to dilate the pupil, it will causes the pupillary dilation, but not seen with the halothane. So, the anesthetic action, when the person enter into the stage 4, the respiratory depression or any anesthetic action is depend upon the anesthetic drug. So, here I had given you best example like halothane and ether. So, halothane is an anesthetic drug. Once you administer the halothane, when it entered into the 4th stage or the stages, when it entered into these stages, the halothane can induce the hypotension, which you cannot see with the cannot see, which will be somewhat less with the ether. And if I am talking about ether can produces the pupillary dilation, it can dilate the pupil, but this dilation of pupil not seen with the halothane drug. So, the drug action will be different with the different anesthetic drugs. So, these are the stages of anesthesia. So, what are the stages of anesthesia? We having mainly 4 stages of anesthesia. Stage 1, which you can call as stage of analgesia. Stage 2, you can call as stage of delirium and stage of excitement. Stage 3 is called as an surgical anesthesia, and stage 4 is called as any respiratory depression. In first stage, you can perform or you can carry with the minor operations, and at stage 3 you can go with the major operation. And the stage 2, where the person cannot cooperate with the particular situation, like he may shout, he may excite on the particular stage, right. And when the person enter into the stage 3 and after to that stage 4, here the anesthesia will enter deep into the body and will causes the respiratory depression. If the anesthesia dose has been increased, the person can even die also. Okay. Next, the techniques. So, what are the techniques of the anesthetics? We having mainly 4 types of techniques. One is open method technique, second one is semi-open method technique, third one is semi-closed technique and completely closed technique. So, we having mainly 4 techniques. One is open method, semi-open method, semi-closed method and closed method. So, what about the open method? Open method, here no need of any anesthetic operator. So, here anesthetic there is no necessity for the anesthetic operator. So, this technique is an open method. So, there is no necessity of any anesthetic operator. What about any semi-open method? The name itself indicating semi-open, somewhat it will be open. So, here well fitted mask will be used. So, mask like operator you can use it at this stage. Okay, next one is a semi-closed method. At the semi-closed method involves the accumulation and rebreathing of carbon dioxide. So, semi-closed, it was somewhat the semi-open, semi-closed, it is both almost similar. In this semi-closed, you can involve the accumulation and rebreathing of carbon dioxide. And closed method, in the closed method we need complicated apparatus. Okay? On the open method no need of apparatus, and in closed method we need the complicated apparatus. So, these are the 4 techniques for the general anesthetics. One is open method, semi-open method, semi-closed method, and finally closed method. And now we will move to the classification. By the classification you can understand the what are the drugs will falls under the general anesthetic drugs. So, what are the drugs you can use as a general anesthetic drugs. So, here the general anesthetic drugs has been majorly classified into 2 types. What are they? Inhalation general anesthetic drugs and intravenous general anesthetic drugs. So, these general anesthetic drugs has been classified into mainly 2 categories. What are they? Yes, there are inhalation anesthetic drugs and intravenous anesthetic drugs. If you are talking about the inhalation anesthetic drugs, it is further classified into volatile liquids and gases. So, inhalation is further classified into volatile liquids and second one is gases. In next slide I will explain you what are the examples falls under volatile liquids and what are the examples falls under gases. And second one is intravenous anesthetic drugs. Intravenous anesthetic drugs has been further classified into fast acting drugs and slow acting drugs. So, whenever you had given the drug by the intravenous route, some drugs are going to show its action fastly and some drugs which will show its action by slowly. So, fast drugs, in next slide I will explain you what are the fast acting drugs and what are the slow acting drugs. So, the fast acting, the slow acting drugs are mainly benzodiazepines, opioids, neuroleptic agents, all these falls under the slow acting. So, what are the classification in the general anesthetic drugs? The general anesthetic drugs has been mainly classified into 2 categories. One is inhalation anesthesia and second one is intravenous anesthesia. In inhalation anesthesia, it has been further classified into volatile liquids and gases. And what about the intravenous anesthesia? Intravenous anesthesia is also further classified into short acting drugs and long acting drugs. The short acting drugs are neuroleptics, benzodiazepines, opioids. We will see the drugs, individual drugs, right. So, these are the drugs we will see here. So, the first one in the previous slide I have explained you the inhalation anesthetics. Inhalation anesthetics, one of the subheading was volatile liquids. So, what are the volatile liquids? What are the volatile liquid general anesthetic drugs you are going to use here? So, here chloroform, ether, halothane, enflurane, isoflurane, desflurane, methoxyflurane, all these are the drugs which falls under volatile liquids. What about gases? Nitrous oxide, cyclopropine, these are the drugs which falls under gases inhalation anesthetics. Now, we will move to the intravenous anesthetics. Okay. The intravenous anesthetics has been classified into mainly 2 types. What are they? One is fast acting drug and second one is the slow acting drugs. So, what are the drugs comes under fast acting drugs? So, inducing agents will falls under the long acting drugs. So, fast acting drugs, the inducing agents will shows its action very fastly. So, what are the inducing agents? Thiopentone, methotrexate, propofol, ethomidate, ketamine, all these are the drugs which falls under which category? Fast acting drugs. And what about the slow acting drugs? The slow acting drugs are benzodiazepines, opioids and neuroleptics. So, what are the benzodiazepine drugs you can use as a general anesthetics? Diazepam, lorazepam, midazolam. Okay, these are the drugs, these are the benzodiazepine drugs you can use as an intravenous general anesthetic drugs. These are the slow acting drugs. Okay. And what are the opioids? So, opioids, so there is a lot of opioid drugs which you can use as a general anesthetic drugs. All these drugs are the slow acting drugs. And what about the neuroleptic agent? Doperidol. Doperidol is a drug which is a neuroleptic drug which shows its action slowly, which will falls under the intravenous anesthetics. All these are the drugs which you can administer by the intravenous route. Okay, intravenous route has been classified into fast acting and slow acting. In fast acting you can see the inducing agents, in slow acting you can see the benzodiazepines, opioids and neuroleptic drugs. Okay, now we will see the mode of action. So, this is very important thing in the particular topic. By understanding the mode of action of a particular drug, you can understand the topic will be the very much clear how the drug is showing its action in the body, right. So, we will see the mode of action of a general anesthetic drugs. So, here the mainly general anesthetic drugs will focus on inhibiting the excitatory neurotransmitter or promoting the inhibitory neurotransmitter. So, before going to the particular neurotransmitter, let us see what is the general anesthetic drugs will do here. The main mechanism of general anesthetics was not clear. Why it is not clear? Because the specific receptor, wide specific receptor, because of its structural variation will be very wide. Because of its wide structural variation, the mechanism of action was somewhat it was not clear, right. And the Mayer and Overton on the year 1901, he had declared and he had proposed a lipid theory. What theory had proposed? Lipid theory. What the theory states here, how much drug has been soluble in the lipid bilayer, that much anesthetic action you can see with the particular drug. So, this is the assumption. This is the assumption how much the anesthesia drug will be soluble in the lipid layer, that much anesthetic drug. And later on researchers has declared that the main anesthetic action is due to because of binding to the opening of a chloride channel. The main action is due to the ion channel receptor. Okay. So, the anesthetic drugs here, what about these anesthetic drugs? The main mechanism of action of a general anesthetic drugs will focus on the two categories. One is promoting the inhibitory neurotransmitter. जो inhibitory neurotransmitter action, it have to promote the inhibitory neurotransmitter action, or it have to inhibit the excitatory neurotransmitter. First thing, you have to inhibit the excitatory neurotransmitter, because by the excitatory neurotransmitter you can induce the pain. The excitatory neurotransmitter is responsible for the pain induction. So, we have to decrease the pain, we have to relieve the pain. So, this is the reason why you have to block or why you have to inhibit the excitatory neurotransmitter. So, to produce the analgesic action, to produce the sedative action, we have to promote the inhibitory neurotransmitter. So, the general anesthetic drugs mainly concentrate on the inhibiting the excitatory neurotransmitter or promoting the inhibitory neurotransmitter. So, there are some drugs which will act on inhibiting the excitatory neurotransmitter, or there are some drugs which will promote the inhibitory neurotransmitter. So, if I am talking about the inhalation anesthetics, so inhalation anesthetics, the drugs will promote the inhibitory, it will promote the inhibitory neurotransmitter action, especially it will bind to the GABA-A receptor. Okay? And when this inhalation anesthetic go and bind to the GABA-A receptor, it will promote the, or it will increases the inhibitory neurotransmitter action. On other hand, like nitrous oxide and ketamine. Okay. On other hand, like nitrous oxide and ketamine, these are the drugs which will inhibit the excitatory neurotransmitter. So, some drugs in the general anesthetic drugs are going to inhibit the excitatory neurotransmitter. There are such a drugs which are going to promote the inhibitory neurotransmitters. So, promoting the inhibitory neurotransmitter drugs are inhalation anesthetic drugs, and nitrous oxide and ketamine are the drugs which will inhibit the excitatory neurotransmitter. So, if I am talking about the mode of action in detail, here if I am talking about the NMDA receptors, okay, what is the NMDA receptor? The NMDA receptor is an excitatory neurotransmitter receptor. So, what is the action? What is the mode of action of general anesthetic drugs? The mode of action of general anesthetic drug was to inhibit the excitatory neurotransmitter. How it will inhibit the excitatory neurotransmitter? So, it have to block this receptor. By blocking of this receptor, because this receptor is responsible for promoting the excitatory action. So, by blocking of this receptor, you can inhibit the excitatory neurotransmitter action. Okay. So, which drugs are going to inhibit this type of receptor? Especially nitrous oxide, ketamine, xenon. These are the drugs which will inhibit the excitatory neurotransmitter. Especially it will go and bind to the NMDA receptor. NMDA receptor is meant for opening of calcium channel. Once the calcium channel has been opened, the calcium will enter into the cell. The calcium, once the positivity enter into the cell, which can causes the cell depolarization, cell excitation, which can induce the pain. So, which we should not need here. So, the general anesthetic drugs will block these NMDA receptor. By blocking of these NMDA receptor, there will be no opening of calcium channel. If there is no opening of calcium channel, there will be no depolarization inside the cell. In a such a way, the ketamine drug, nitrous oxide drug, it will decreases the excitation of this receptor. On other hand, there are some drugs which are go and bind to the GABA receptor, and when I am talking about this GABA receptor, it having mainly 3 types of receptors: GABA A, GABA B and GABA C. The first GABA A and GABA C both are ion channel receptor, and the center one GABA B, it is an metabotropic receptor, it is an Z protein coupled receptor. So, now specially these general anesthetic drugs will go and bind to the GABA A receptor and it will promote the excitatory action. It is a GABA receptor is a pentameric in structure, it having 2 alpha receptors, 2 beta receptor and 1 gamma subunit. Okay. So, if I am talking about this mode of action, just now I had said that having the 4 transmembrane ion channel, it having 4 subunit like 2 alpha subunit, 2 beta subunit and 1 gamma subunit, and each subunit having the N terminal on the extracellular chain, and 1 extracellular chain you can see and 2 intracellular loops you can observe connecting to these regions and with the C terminal. So, this is the structure of an GABA. So, by here I had completed the GABA neurotransmitter. Thank you.